10. NCLEX medication prioritization questions with rationales. Let's start with question number 1. The nurse receives report on 4 patients. Which client should the nurse assess first? Letter A. A client with pneumonia who has a temperature of 101 and productive cough. Letter B. A client with pancreatitis reporting abdominal pain 8 out of 10 after morphine. Letter C. Client with suspected infection who is confused, has a blood pressure of 84/50 and warm flush skin. Letter D. Client with heart failure who gained 2 pounds overnight and has bilateral uncal edema. So let's look at the correct answer. It's going to be letter C. A client with suspected infection who's confused, has a blood pressure of 84/50 and warm flush skin. This client has signs of poor perfusion and possible sepsis. New confusion with hypotension, is unstable and needs rapid assessment and intervention. Let's look at question number 2. 4 clients call the nurse at the same time. Which client should the nurse see first? Letter A. Client receiving packed RBC who reports chills and low back pain 15 minutes after the transfusion. Letter B. Client receiving vancomycin who has redness and itching during the infusion. Letter C. Client taking iron tablets who reports dark stools and constipation. And letter D. Client receiving total parenteral nutrition whose finger stick blood glucose level is 183 milligrams per deciliter. Okay, so let's find the correct answer here. So letter A, patient receiving red blood cell who reports chills and low back pain 15 minutes after the transfusion started. So this is the reason. Chills and low back pain shortly after blood transfusion suggest an acute hemolytic transfusion reaction, which is a life-threatening condition and requires interaction and immediate actions. I'm sorry. So the remaining choices are expected, and especially letter B, even though it's causing some redness or itching, that's what we normally say about Redmond syndrome. Let's go to question number 3. The nurse reviews morning data for 4 clients. Which finding requires the most immediate follow-up? Letter A. A potassium of 6.4 with peak T waves on the cardiac monitor. Letter B. A sodium of 128 with headache and nausea. Letter C. Calcium of 7.6 with tingling around the mouth. Or letter D. Magnesium 1.4 with mild tremors. Okay, so the correct answer is letter A, definitely, right? Potassium that high is very dangerous. So hyperkalemia with ECG changes can lead to lethal arrhythmia and perhaps cardiac arrest. This is an immediate cardiac threat, so that's why this is the priority. The rest are all abnormal, but even though they're abnormal, their symptoms are not that severe. That's the reason why letter A is correct. Let's go to question number 4. A pediatric nurse is assigned to 4 children. Which child should the nurse assess first? Letter A. Child with barking cough who improves after cool mist therapy. Letter B. Child sitting upright, drooling, and refusing to swallow. Letter C. Child with bronchiolitis who has mild wheezing and oxygen saturation of 94%. Or letter D. Child with otitis media who is crying and pulling at one ear. So let's look at the correct answer. I'll click on that. The correct answer is letter B, child sitting upright, drooling, and refusing to swallow. That position alone, the drooling, tripod positioning, and refusal to swallow suggests possible upper airway obstruction. So airway rest is a priority. So by the way, if you're studying for NCLEX or just trying to prep ahead of time, tell me what topic you want me to cover. On the comment section so that I can cover it. I can do actually NCLEX stiff if you're familiar with my TikTok account. I do a lot of NCLEX stick, so I don't know if that's beneficial for the YouTube watchers. So let's go to question number 5. The nurse is caring for 4 postpartum clients. Which client requires immediate assessment? So let's say client 2 hours after birth with a boggy uterus, heavy lochia, and dizziness. Client 12 hours after birth with perineal pain rated at 6 out of 10. Client, letter C, client 1 day after C-section with incisional pain when coughing. Letter D, client breastfeeding who reports nipple tenderness during latch. This is during lactation. Okay, so let's look at the correct answer. It's going to be letter A, client 2 hours after birth with boggy uterus. That's just a sign that there is possible uterine atony, right? Heavy lochia and dizziness. So boggy uterus with heavy bleeding and dizziness suggests uterine atony. There you go with hemorrhage. This threatens circulation and needs immediate action because if not, then the patient can go to hemorrhagic shock and become very, very hypovolemic. Let's go to the next question. The nurse is assisting with care in the PACU. Which client should be assessed first? Letter A, client with temperature of 105, rigid jaw muscles, and rising end-tidal CO2. Letter B, client with nausea after receiving an opioid during surgery. Letter C, client reporting incisional pain, rated 7 out of 10 after abdominal surgery. Or letter D, client with a blood pressure of 152 over 88 after stopping anesthesia. So what's the correct answer here? Okay, it's going to be letter A. That's telling you it's malignant hyperthermia. Those are clinical manifestations of hyperthermia, malignant hyperthermia, 105, very high fever. There is already muscle rigidity, and then the end-tidal CO2 is really building up. These are really classic signs of malignant hyperthermia, and this is a life-threatening condition and requires rapid treatment. So the drug of choice here would be dantrolene sodium. Let's go to question number 7. The nurse is monitoring for clients with neurologic conditions. Which finding is the priority? Letter A, a client with a headache rated 8 out of 10 after a lumbar puncture. Letter B, client with new unequal pupils and a widening pulse pressure. Letter C, client with Parkinson's disease who has a shuffling gait before medication. Or letter D, client with multiple sclerosis who reports fatigue after physical therapy. Okay, so that's gonna be question number 7, and this is the correct answer. Letter B, client with new unequal pupils and widening pulse pressure. That tells us that there is a potential increased risk of increased intracranial pressure and possible brain herniation. This requires immediate action, so it's gonna be letter B. Okay. How's everybody doing? If you're able to, if you're watching question number 8 and you're still here, thank you very much. If you could put in the comment where you are watching this video, that would tell me the location and just to tell me in terms of demographics, the nursing students that are watching my videos. Question number 8, the nurse receives report on 4 clients in a mental health unit. Which client should the nurse see first? Letter A, client with depression who says, I gave my roommate my favorite jacket because I will not need it. Letter B, client with anxiety who reports palpitations before group therapy. Letter C, client with schizophrenia who's pacing and talking to unseen others. Whereas letter D, client with bipolar disorder who slept 3 hours and is talking loud. Okay, so let's look at the answer. Okay, correct answer is going to be letter A. Client with depression who says, I gave my roommate my favorite jacket because I will not need it. Giving away belongings, stating they will not need it, signals suicide intent, so safety is a priority. That's our Maslow's hierarchy of needs as well. Question number 9. A nurse is caring for 4 clients with tubes and drains. Which client should the nurse assess first? Letter A. Client with a chest tube has drainage change from 80 to 20 ml per hour. Client with nasogastric tube who has a 250 green drainage in 4 hours. Or letter C. Client with a urinary catheter who has 30 ml of clear yellow urine. And letter D. Client with a chest tube who has sudden dyspnea, tracheal deviation, and no bubbling in the water seal. Which one are you gonna see first? Okay, so the correct answer is letter D. Client with a chest tube who has sudden dyspnea, tracheal deviation, and no bubbling in the water seal. So sudden dyspnea with tracheal deviation can indicate tension, pneumo, or blocked chest tube. This threatens breathing. Then eventually it's going to cause some circulatory problem. Question number 10. The nurse receives lab results and assessment data for 4 clients. Which client should the nurse assess first? So letter A, client taking lithium who has, of course, tremors, vomiting, and new confusion. Letter B, client taking prednisone who has a fasting glucose of 168. Letter C, client taking digoxin who has an apical pulse of 58 without symptoms. Letter D, client taking levothyroxine who reports feeling tired in the afternoon. Okay, letter A is the correct answer. Client taking lithium, he has coarse tremors, so that's our toxicity level in there, vomiting and new confusion. So these are suggestive of lithium toxicity. This can progress to seizure, coma, and dysrhythmia. So what's your score? What's your score? Write it in the comment section, please. Thank you for watching and tell your classmates and friends about the channel. Thank you.